Hi, my name is Karen Stainton, and I am here with Anna, who's going to play my student in our role play. The nurse practitioner student characteristic or preceptee characteristic that I have been assigned is a student who is not ready for the clinical environment due to either lack of maturity, professionalism, or previous study. So, good morning, Anna. I see that you're here right on time, which is good. It looks like we have a busy clinic day ahead, and I wanted to take a few minutes to touch base before we begin our day. Are you ready to get started?
Sure.
I know that this is the 4th week of your clinic rotation here, and I'm very pleased you're here. I would like you to have you review your goals for the clinical rotation and just make sure we're on track with your progress. This helps me see if there are areas that we need to focus on. Can you tell me about your goals and how you feel you're doing and progressing towards meeting them?
I don't really know what my goals are. I guess just to learn as much as I can while I'm here. I've been a nurse, for 10 years, so a lot of this is pretty familiar to me. And I guess I'm just not sure what I need to be focusing on or what is so different, really, than what I've been doing as a nurse.
Well, I think you brought up some excellent points, and I would like to go ahead and take this opportunity now that we're in this office just by ourselves to talk a little bit more privately and quietly and have a chance to talk about this. I have been observing you in many interactions these last few weeks, and I'm really impressed with how you are empathetic and can connect with the patients. I can see that you're a very caring person in your role as a nurse. This is really a wonderful quality. But let's talk a little bit about how the NP role is different than what you are used to in your previous nursing role. Can you tell me what you understand the nurse practitioner role involves? Did you read about this as we talked about at your first day of clinical?
Not really. I guess it means I'm more in charge. I need to be able to take control of the plan of care for the patient.
Well, yes, it does mean that your level of responsibility for directing the care is greater, and you are always a part of a team, and interacting and utilizing those team members in a professional way is essential. I imagine it's hard to assess your progress if you are not clear on what your goals are. But I do want to point out that overall the objectives of any clinical rotation are to be able to apply the didactic learning you are covering in your coursework to the clinical situation. I have some significant concerns that you're struggling with this. Tell me how you feel your coursework is preparing you for the clinical experience.
Well, I'm struggling to get the work done with school and managing the clinicals. And because I just have a lot of demands on my time because I also work full time. Sometimes I just don't see how it is relevant. I really don't want to do the extra work for clinical because the time I spend here really should be enough and meets the requirements of the course that I'm taking.
So I am hearing a number of things that raise concerns for me, that you're struggling in your coursework, that you don't see how it applies to the clinical experience, and that you don't want extra work to be added during your clinicals. Tell me how you see yourself progressing in this program with these areas of concerns.
Well, I guess I'm not sure. I just want to get through. I guess I thought this MP thing was a good idea, but maybe I'm not sure now. I guess I really didn't think about what the role was, and I'm not sure I want to commit to all of that.
As your preceptor, I'm here to help you achieve your goals in this clinical, but I am understanding you to say that this is maybe more or not exactly what you understood the advanced practice nursing role to be. You've been very competent in your nursing role, and I'm concerned without dedicated effort on your part that your ability to progress into an advanced practice role will be significantly compromised. I feel these are very important issues for you to reflect on. I feel it's important for your program faculty to understand where you are with these issues and the concerns I have about your preparedness and competency. I will be communicating this information to them, and I'm hopeful that we can all reach an agreement about what the best course of action for you is. I appreciate that you have been honest with me about where you stand with these issues and want the best outcome for you, but always, clinical competence is something that must be achieved before you can ever practice independently. I would like to have you think about these things, and we'll proceed with our day and revisit this again before your next scheduled clinical day. If you do feel you want to discuss things further before then, feel free to email me and we can set up a lunch meeting.
Okay.